Hey everyone, welcome back to PBC Buddy. Today we're doing a dosage forms crash course for PBC prep. The common forms, their pros and cons, and the key Biopharm points PBC-style questions love. And yes, MCQs are coming near the end. Also, watch our EE study plan plus resources video for the full roadmap. Before we jump into details, think of dosage forms in buckets. Oral solids, oral liquids, and then the other forms like topicals, suppositories, injectables, patches, and inhalers. On exams, the trick is the dosage form changes onset, stability, technique, and safety. So always ask, what's the form trying to solve? Tablets are the classic solid oral unit dose, immediate release or modified release. They're stable, accurate, and low cost, but can be slower onset than liquids and harder for some patients to swallow. Exam tip: if you see modified release, assume don't crush or split unless clearly allowed. Capsules are drug inside a shell, powder, granules, or sometimes liquid fill. They can hide taste and may be easier to swallow, but shells can be moisture sensitive and many capsules can't be split. Exam tip: some capsules can be opened and sprinkled, but only if the product allows it. Powders and granules often show up as reconstitution products. Stability is usually better before mixing, and dosing can be flexible, but measuring errors and technique problems are common. Exam tip: if it's reconstituted, think final concentration, storage, and beyond use or expiry instructions. Solutions are drugs fully dissolved, often the fastest oral onset because there's no dissolution step. Great for flexible dosing and pediatrics, but stability, taste, and dosing device accuracy matter. Exam tip: solutions are usually faster, but don't forget preservatives and storage. Suspensions are particles dispersed in liquid, helpful for poorly soluble drugs, but settling can cause inaccurate dosing if not mixed well. Exam tip: if it's a suspension, your brain should immediately say shake well. That phrase shows up in MCQs a lot. Now the high-yield science part. Dispersions and colloids are about particle size and how things behave in a medium. Smaller particles usually mean more surface area and faster dissolution, while higher viscosity can slow diffusion and release. Exam tip: when you see particle size or viscosity, it's usually pointing to release rate. Emulsions are oil and water systems, like O/W or W/O. They can deliver lipophilic drugs and improve palatability, but separation risk is a big stability issue. Exam tip: if a question mentions layers as separating, it's basically screaming emulsion stability problem. Topicals are mainly for local skin effect, different from Transdermal, which aims systemic delivery. Ointments are more oily and occlusive. Lotions spread easily on large or hairy areas, and creams are usually the middle ground. Example products include topical corticosteroids like betamethasone, Betaderm, which can come as cream or ointment. Topicals can deliver a higher dose right where you need it and often have fewer systemic effects, but absorption is variable and technique matters a lot. Exam tip: match the vehicle to the skin. Dry and thick lesions often prefer more occlusive forms, and big/hairy areas do better with lighter forms. Quick chart time: ointment versus cream versus lotion versus gel versus paste. This slide is designed for fast revision. Just remember, occlusive versus spreadability is usually the exam logic. Suppositories can be rectal or vaginal and melt or dissolve. They're useful when a patient can't take oral meds and may avoid some first-pass effects. But absorption is variable and patient acceptability can be an issue. Exam tip: expect variability, don't assume perfect absorption. Injectables are sterile preparations for rapid systemic effect. Forgives 100% bioavailability, while IM and SC can vary by blood flow and formulation. Exam tip: sterile technique and safety risks matter, and route selection often matches urgency and onset. Transdermal patches deliver drugs slowly through the skin over hours or days. Great for steady levels and adherence, but slower onset, skin irritation, and limited drug suitability are common. Exam tip: heat can increase absorption for some patches. Always think safety. Inhaled meds can be fast with lower systemic exposure, but they're technique-heavy. Main device families include pMDI, DPI, nebulizer, and soft mist. Next video will go deep into inhaler types and technique traps. Core foundation, solubility, pH, dissolution, permeability, and excipients. Particle size usually impacts dissolution, and excipients like surfactants or disintegrants can change performance. Exam tip: identify the rate-limiting step. That's how you pick the best answer. Solutions often skip dissolution, so onset can be faster. Tablets and capsules require disintegration and dissolution first. Topicals depend on diffusion and vehicle choice. Inhalers depend on particle size and inspiratory flow affecting deposition. Now pause and do the 5 MCQs on screen. Don't rush, pretend it's exam day, and pick the best answer based on the dosage form logic. Answers: solution is fastest oral onset. Suspensions must be shaken. Ointments are most occlusive for his 100% bioavailability, and pMDIs are very technique dependent. For more practice, download the PDF linked in the description. And don't forget, subscribe and click the bell icon so you're first to get the next inhaler video.